So treat and extend has increasingly become the favored regimen to start patients with neovascular AMD on the management. It gives the advantage of being a proactive approach, so we anticipate as well as reduce any recurrence in activity and safeguard the visual gain that we have achieved during the initial loading phase. And during this conference, I was very happy to see increasing amount of data from randomized controlled trials which continue to support the success of treat-and-knee approach. So during Euretina, we've heard about the Altair study as well as the ARIS studies. So these two studies looked at various adjustments to the traditional treat and extend protocol. So for example, in Altair, we saw after the initial 4 doses of aflibercept, patients then were started to be on treat and extend protocol either with a 2-weekly increment or with a 4-weekly increment, and the results show that in both arms patients achieved very good visual outcome which were comparable. And again, as expected, we saw a very significant reduction in the number of injections during the first year, on average about 7, but in the second year reducing to less than 4, and over half of patients managed to come to a retreatment interval of 12 weeks and longer, which makes it much more easy to maintain patients on long-term treatment, which we know is very important for the treatment of neovascular AMD, so that the initial gains are not lost in subsequent years. In the ARIS study, we also learned that treat and extend starting in the first year instead of compared to starting after the first year also achieved very good outcome when we look at the week 52 endpoint. So I think we've come to learn more about treat and extend, and these studies add to the flexibility and options that we can tailor a personalized treatment journey for each patient's need.